Good morning. Very excited to see us talk about FemTech at the Asian Health Innovation Summit for the first time. My name is Maaike Steinbach. I'm the founder of FemTech Future. We are a boutique advisory and consultancy company on FemTech. I, until last year, was the CEO of Visa for Hong Kong and Macau. But considering the importance of women's health and particularly the way technology can support women's health, I resigned to focus to help these amazing startups, particularly in Hong Kong and across Asia, to thrive and to connect with corporates and insurers to grow their business. Now, I can hear you wondering, what is FemTech? A lot of people I speak to actually after a while go, yeah, we know fintech. No, FemTech. So the term FemTech actually came from a woman founder from Denmark called Ida Tin. And in 2018, she founded a company called Clue, a period tracker. And one of her investors asked her, like, what is it that you actually do? What kind of technology is it? And she termed the term FemTech. So what is it? It is basically products and services that use technology to support the health and well-being of women. And this could be across all spectrums. So this is physical health, mental health, and sexual health. And it ranges everything from apps like period trackers, maternity platforms, menopause solutions, wearables, and apps. But increasingly diagnostics and treatment for non-reproductive health diseases, but issues that disproportionately affect women. So think about cardiovascular disease, think about autoimmune disease, think about Alzheimer's. And the reason why this is so important is because we have a gender health gap. And a gender health gap is also a term I need to explain, which basically means that because of the differences between men and women, the existing healthcare system is unable to support women with the products and services that they need, which have to be personalized and customized to their specific needs and wants. So in able to close that gender health gap, we need technology to support, particularly women. So I am incredibly excited to today have these three amazing female founders from Asia, from Hong Kong, working in Hong Kong, looking to grow their business. I've known them for quite a while, but they tend to work a little bit in the shadows, as a lot of female founders do. So I'm very proud to give them a stage today. And I'd like them to introduce themselves, their business, and how they started their FemTech startup journey. So Natasha, over to you.
Hi everyone, my name's Natasha King. I'm the co-founder and CEO of Blissmi. So I'll tell you a little bit about what Blissmi does. Blissmi is a SaaS health tech and insurtech platform. I know a lot of jargon is just thrown at you, but fundamentally what we're doing is to service three beneficiaries. The first one is the beneficiary of the woman. So we use AI to predict and personalize a woman's journey at all stages of her life, from menstrual all the way through to menopause and everywhere in between. We also now have since pivoted and figured that actually we also need to help men out. So we also help the holistic health journeys of men and women through mental health and fertility as well. So that's our first group. Second group is obviously the insurance companies. We want to help them to be able to mitigate risk, to be able to manage their claims, to tailor their premiums, and to fundamentally service their clients with more preventive holistic healthcare journeys. And that brings me to the last beneficiary group, which is the corporates. So the companies that employ us women and us men to be able to facilitate the ability to access holistic healthcare, because in that way we really believe that women and men can actually have better health, and that we stop using the words healthcare but we move towards health management. And just very quickly how we got here, stories stories from women, stories from women in my life, in my co-founder's life, in the network. We had a woman that actually came to us and said, I work in HR for one of the large multinational organizations, and a woman took 26 weeks off for maternity leave. And my manager, who's the head of HR, said to me, please remove her entitlement for annual leave because she's already had 26 weeks off to have a baby. And she needs to come into work immediately, and she cannot take leave anymore. And this is unfortunately not uncommon, and it is very much in the shadows as well. And so what we're trying to do is to raise awareness. So this is fundamentally what Blissmi is here to do. But yes.
Thank you. Thank you, Natasha. Welcome. So our next guest is Anca Griffiths. So Anca is actually the co-founder of HealthHub, but she's also the author of this book, Why Women Aren't Women at Health But Can. So if any of you are interested in actually learning more about women's health, about FemTech, about the gender health gap, the gender data gap, the gender research gap, this book has it all. Anca actually has a booth where you can pick it up and have a look at it. But Anca, your story.
Thank you so much. Hi, everybody. It's so good to be here. A bit about myself. So I'm Canadian. I've moved out of Canada a while ago. I worked 6 years in Paris, and I've been in Asia for about 13 years. Big part of that time, I used to work for a luxury group, and that's about 14 years that I spent with them, helping luxury brands to entice consumers, because a luxury product is what you're paying for is what you're captivated by, right? Wasn't thinking about shifting until I experienced a few things with my own health, notably postpartum, miscarriages, and I thought, well, why is it that in these moments that we go through, A, I'm widely uninformed about what's happening in my own body, but two, the other thing that struck me was I don't know what tools there are for my health during these points. But after living in North America, Europe, and now Asia, I knew that different places were doing different things well. And then I started looking at the health space, and what I saw was, one, this huge disconnect. You have a space where women are 80% of consumers. We are, insurance companies know this, and if you're in this space, you know the numbers. Women control 80% of consumption when it comes to health and wellness. Yet, where were these products for us, right? Like, who's doing this in a way to entice us to take care of our own health? So that's where OM got started. I thought, well, clearly what we need is to go to where the information is richest for women's health. Is it, pelvic floor care out of France? Is it brain health out of University of Melbourne? And so we started putting, a community of health experts that are at the cutting edge of knowledge, and you'll understand a little bit later why this is crucial for women's health. And then the second thing, which is just as important, is they're not pushing any products. They're not coming in to say, oh, you want to fix your midlife sleep health? Here's, a gummy that will get you there. They know what works, they know what doesn't, and where the gaps are. Now, the second challenge that I have is, how do I take this incredible knowledge and I make it super captivating for people to come in on? Because again, when you look at women's health or the health information that we absorb, what do we get? We get, 23-year-olds on TikTok telling us about, detox diets. And that's what we absorb: intermittent fasting, powders, detoxes. When we know that up to 90% of diseases can be prevented, I can tell you, after working with a community of health experts, we're very far at knowing how to actually prevent these diseases. So OM is basically a platform, a bit like the Netflix of health, where you find the best experts and you find, for every part of your health journey, programs on how to optimize your health. Wrote a book with my two co-founders as well to explain to women what's happening in the sector so that they're empowered when they go forward in their journey.
Thank you, Anca. Very inspiring. Look forward to hearing more. Last but definitely not least, Grace. Grace O. So in Asia, we roughly, if we take away Japan and if we take away India, we roughly have around 120 FemTech companies, of which probably 60 to 70% of them started in the last 5 years. So it's very fresh. I think the minister just spoke about the frontier technology. It's definitely frontier technology. Grace, you're the newest of the pack. Talk to us about Soul, Spring of Life.
Hi, I'm so glad that I'm here. My name is Grace O. I'm the founder of Soul. Basically, we are trying to provide the most comprehensive app for menopausal women who are in perimenopause to menopause to postmenopause. And there are a lot of them in the world. Actually, we are estimating about 1.3 billion in the world. But the personal story I have is that, you know, as other founders have talked about, you know, we have a lot of experience of being dismissed by our own doctors. I don't think they mean to dismiss us, but it's more of the lack of research and lack of understanding of women's bodies and how women's symptoms might, you know, appear differently than men's symptoms. Even if it's a heart attack, you know, women's heart attack might be not diagnosed, you know, in the proper time. So, you know, that's the main problem that we have. So I wanted to create something that's very comprehensive and basically based on not only conventional medicine that, you know, a lot of people are relying on, like HRT or medication, but lifestyle medicine that's an up and coming kind of field that has a lot of evidence, and also complementary medicine, because a lot of people in Asia also, they rely on Chinese medicine, traditional Chinese medicine, and other methods of treatment. So we want to consolidate all these things based on evidence and work with different professionals who know menopause. They're up and coming. I'm sure the number is growing. And I think there's more awareness among professionals to also know that there has to be more training. So it's very exciting. So we're collaborating with a lot of doctors and clinics and other practitioners who can help women. And women can also connect with other women like them in the community, because we also realize that ethnicity and culture is a huge part of this whole experience. And the symptoms are also very different depending on, you know, whether you're South Asian or East Asian or Caucasian.
Yeah, thanks, Grace. So I'm going to stick with you because you mentioned a few interesting topics. So how do you think the perception of general and women's health has changed over the last few years? You already mentioned a few points, but how do you think FemTech in particular kind of helped change some of that perception?
Yeah, I think women have been considered as little men, like, I mean, not very different than men, other than the fact that, you know, we can deliver babies, right? So, you know, other than the fact that, you know, maybe fertility treatment or, you know, pregnancy, those are separate areas. But when it comes to other parts of women's health, mental health, you know, cognition or anything else like heart health, osteoporosis, kind of bone health, it didn't have enough attention, that there has to be a separate research on women. And as you are all aware, a lot of research is not being done on women specifically, right? So traditionally, you know, a lot of data and research have been on men only, and women have been kind of excluded from that for various reasons, and that's a problem, right? So we don't know what kind of dosage we need to take for pharmaceutical drug. We don't know what side effects we might have that's different than men. And when it comes to more women-specific conditions, and conditions that might appear a little bit differently, you know, we mentioned like osteoporosis, heart disease, you know, and Alzheimer's, all those things. There isn't enough research. So I think what we are trying to do, and a lot of FemTech companies globally are doing well, I think, is, you know, actually bringing this awareness that there's a huge research and data gap. And we are trying to come up with a innovative solution using data and technology, and basically advance this whole, you know, result in the healthcare. Because right now we know that the conventional healthcare model is not sustainable, and a lot of societies have aging population, and Hong Kong in particular has a huge number. I just researched, you know, more than 50% of the women population is over 45, so it's a huge number compared to the rest of the world, which is about 30. So I think FemTech companies are doing that and collaborating with research organizations to pool data and contribute more to the research that's really needed.
Yeah, thank you for that. So Natasha, maybe the theme of this panel is breaking barriers. So what kind of barriers have you encountered, maybe just in the healthcare industry, regarding women's health on your journey or the Blissmi journey?
Yep, so I think the biggest barriers are probably a little bit more surprising. It's besides all the obvious, the lack of research and women involved in research since before the 1990s. It's also the fact that I think women themselves don't really look to invest in themselves. I mean, a show of hands for the women and the men if you want to participate. If you have an hour in your day, would you think, I'm going to get maybe some sound meditation and some sound healing now because I think that will soothe me, or go get some acupuncture, or will you spend your hour doing your to-do list? Honestly, who's going to do the sound meditation and like things that will be good for you? Oh, I love you, you're so advanced. Who's the one that's going to sit there and go, I have a to-do list, I'm going to, yeah, exactly. Like, most women don't look to invest in themselves, and I think that is fundamentally the #1 primary barrier. We need to understand that it is our prerogative to invest in our own health and to do what's good for us, because it is fundamentally good for the people around us as well. It is proven that healthy women, actually, the very good adage is like happy wife, happy life, right? I think it's the same thing. Happy women, happy societies. So I think that's definitely the #1 barrier. And I know this is not very, related to technology, but there's a whole gamut of stuff out there.
No, it's very much related to technology, because now I'm going to ask Anca, who is obviously very much in the business of education. Like, how important is education in the narrative for women's health? Both, I guess, for women themselves to own their own health, but also for the rest of society at large.
I mean, it's life-saving, as in, we talk about the gaps. The gaps are huge, and the system is big. And what I mean by the system is the healthcare system. If we're going to wait for the healthcare system to shift, we're going to be waiting quite a while, right? So let's take an example like heart health, right? Now, heart health is the #1 killer of both men and women. Most women actually don't know this because the awareness has been around breast health. But when it comes to care about heart health, the studies, as we mentioned before, have been done primarily on men. So we don't understand how women present with heart disease. We don't understand how to treat heart disease for women. Let's look at this in the number. 50% of women that go to 50% of women that go to the emergency with a heart attack will be sent home with antidepressant. Okay, so when I ask you what are the symptoms of a heart attack, you're probably going to tell me, well, it's tingling in the left arm, it's like pressure on the chest, difficulty breathing. Those are the symptoms of male heart attacks. Females have different types of symptoms, which is gut pain, pain between the shoulders, difficult tiredness. Unfortunately, women don't know this, but also the medical professionals don't know this yet, because it has, even though we've known women heart disease is different, it has not been integrated into medical books. To this day, these symptoms are considered atypical, and it's 50% of population. So where does education come in? We have this amazing program on the HealthHub called the Mind-Heart Connection, where cardiologist tells women, okay, these are the symptoms of a heart attack, and this is what you do when you go to the emergency room so that you get the care you need. So I think education and women advocating for themselves is simply life-saving. So beyond that, I think it's super important, as you said, for women to kind of look and understand their health in the moment they're in. Perimenopause, menopause, postpartum. When you support your body in those moments and you're empowered in the tools that you're tapping into, you can basically, that is preventative health, right? There's nothing more preventative than that. So yeah, that.
Yeah, I mean, some of the stats I've heard before, but they remain just astounding to hear every time. And I think we could go on for hours to talk about many more. So then I'm just going to stick with you, Anca, because we also spoke quite a bit about misinformation, right? So typically digital health and digital health for women obviously uses social media as a big channel, but we also know that increasingly there are two aspects actually. One is censorship, just talking about women's health through digital channels, but the others is also misinformation through influencers. So I know you have an opinion on it.
I
Can
have
you
an opinion on this.
share the challenges?
I think for all of us that are in this field, we're so frustrated because we want to do well by women in their health. And what we're seeing is a shift from women's health being taboo, not understood, not focused on, into, oh my God, this is a great business opportunity. And women are being taken advantage of because in this sector, it's a few things. It's not regulated, right? So if somebody comes out and says, oh, I can fix your migraines again with my detox diet, they can say whatever they want. There's no regulations around this. So that's one. The second thing, again, because we're a huge market, everybody's trying to tap into this. So then call it whatever you want. Menno washing, the pink tax, whatever it is. There's a lot of people coming in the space doing things because they know that women are big consumers in it. But the frustrating thing for us is these tools don't necessarily make women healthier. Right? So, but we spend because the deck is a little bit like stacked against us. We go into a medical system that hasn't studied women. We don't get the care we need there. But we need care, so then we look to the wellness system, and that's where it becomes predatory. So for me, with OM, it's become incredibly important to create a space for women where they can trust the information that's coming there is coming from the best health experts that don't have a vested interest in something, right, and pushing a product in one way or another. So I think it's fantastic that there's more focus on women's health, and it's great that more are coming in this way. But if we're doing a disservice to women's health, if we kind of, I would say, prey on their pain points to push products.
Yeah. Tasha, I see you nodding. Is there anything you wanted to add to that? How is Blissmi kind of making sure that it is getting the right information out?
Yeah, so, thanks. I was just going to add, so Blissmi essentially is kind of like this ecosystem builder. We connect, the end users with holistic healthcare providers, service providers, tech-enabled products, and we really look to find organizations and businesses such like Anca, such as Grace's, that have proven the ability to show results. And I think it is really important that the education actually starts from the service partners and the product partners that we have in this ecosystem, because it's all about the advocacy. What we're doing today, it's about advocating the message and the importance of closing the health equity gap that we see, not just in societies, also in the workplace, in the medical field. This is what we're trying to do. And I think what is really important is that we cannot stop talking about it, because, it's like what Anca is saying. Sometimes it's like a trend. It's like really nice to. I remember when Atkins used to be a thing. Like, I know I'm old, but I just sort of think, and people forget. But it's so important that we do not stop talking about the importance of making healthcare equitable. And I think the misinformation is not that we're not spreading it, but it's also that we're not talking about it. And I think that's a really important facet of what we're trying to do today.
And you touched upon a really important topic, too, actually. One is just collaboration amongst the various companies that are in this space. And secondly, also the wider ecosystem. So do you mind talking a little bit about both? You spoke about the collaboration already, but how do you see that evolve over time?
Yeah, so, and I'm going to do a shameless plug for any healthcare providers or product partners, we don't take a booking fee. We don't take a commission from the people that we work with. And the reason why we do that is because we want to create long-term sustainable partnerships in this ecosystem that we're trying to build. We're not here to make money off people that are wanting to do something good for the beneficiaries of our products, right? So I think collaboration has to be built on mutual trust and respect, and you have to have a common goal as well. So that's that little bit on collaboration. The other thing around ecosystems, and I think it's really important that we look at all the different parties that are involved in creating an ecosystem and making this a successful outcome for all, governments, corporates, and the individuals. Would you like me to talk a little bit about
Yeah,
that?
sure. We were talking about government support here as well as the StartmeupHK Festival. So you're incubated in Hong Kong Science Park.
Yes.
Maybe you can share a little bit about your experience.
Yeah, so first off, because this is recorded, thank you Hong Kong Science and Technology Park for investing and incubating Blissmi. We're very fortunate and lucky actually that we have the Hong Kong government, like InvestHK and all of these initiatives that really want to invest in tech companies like ours that really fulfill a wider goal, a bigger goal. The experience that we've had has been really great because, and as you've heard from previous conversations as well, it's not just about giving you money. It's actually giving you the network, the resources, the guidance, the roadmap, and we've really benefited from this spider web of support that we've received from HKSTP, and we have a dedicated account manager that literally checks in on us all the time. So we're very fortunate that we do have this to support us. And then, in terms of, I guess, the wider ecosystem is, again, that advocacy message. How do we get corporates to want to do something better for their employees and invest in, holistic healthcare for their employees and see that this is not just a tick in the box, let's tick our DEI goals and let's look good on paper, but it is actually a profit conversation. It is a bottom line conversation. When your employees are healthy, motivated, and engaged, you will make money. No one makes money off a sick person who is not really doing anything but clocking in from 9 and clocking off at 9. No one's making money off that. So I think this concept of, ecosystem and collaboration towards a common purpose needs to be very clear.
Yep. Go, Anca.
And another note for me, I've been here for 12 years, and I can tell you, I don't know if I would have been able to do this in any other place than Hong Kong. It's a city that has affordable childcare, and so I can focus on the business. It's a city that's safe. It's a city that has, if you want, a great quality of life. And, Maaike and I are working on an event next year on women's health, and I feel like there's a great opportunity here for Hong Kong to become a beacon of what's happening in the region and also globally for women's health. And I think equally in terms of what the government is doing, but also to feature the city itself as a great place to come and be an entrepreneur. If we put it all down on paper, it's an incredible place to be, and that's it's half-half, right? It allows you to support your family and have peace of mind, and builds the contact. So yeah.
Grace, obviously you're an official out-of-towner, although you spent some time in Hong Kong, but you're based in Singapore. Your product is actually available for Hong Kong consumers going forward. But what has been important for you as part of growing your business in terms of ecosystem support?
I think getting the trust of the professionals and organizations, but luckily I have a medical advisor at a premium clinic who is helping me, and it really opened a lot of doors. And I think, as other speakers said, I think Hong Kong is a great place because it has a global population here, and then there are global companies, but also I think in terms of professionals in the medical field, they're trained overseas. They're trained actually all over the world, right? And then they bring in the best practices here, and then it's a very interesting blend of Asian, like Chinese medicine and other kinds of medicine, and also conventional medicine. So I think it can be a very interesting place here, and a lot of people are open to the idea of collaborating, because at the end of the day, we all want the same thing, right? We want to provide the best care for our consumers, or for the professionals, it means for patients. And we want to provide a personalized care. I mean, no one wants to just have a cookie cutter, treatment for everybody.
Yeah, so I really like the fact that the panel is sharing here that this is a massive commercial opportunity. So obviously this is a pioneer technology and a blue ocean in terms of opportunities. And I feel that the future in this space will really be around collaboration. But just if we look at Hong Kong, apart from the amazing commercial opportunity, there is also a real need. So Hong Kong has some amazing stats, right? So women in Hong Kong are actually going to be the oldest women in the world. So the average age of a woman in Hong Kong is 88 years old. It is the highest in the world. The reality, though, is because of the gender health gap that we spoke about earlier, is that women tend to spend 25% of their life in worse health than men. So that means that on average, a woman spends 9 years in worse health than men. So this is particularly concerning if you look at the aging population in Hong Kong, that the women actually grow older, but they not necessarily, their quality of life does not necessarily get any better as they age. Also, when we talk about brain health, we now know that 1 in 5 women will actually get Alzheimer's, whilst it's only one in 10 men. But if we think about the caregiving role that women play, particularly in economies like Hong Kong, there should be a massive health population imperative for governments and to society to really make sure we keep our women healthy and start with the education around heart health or brain health at a very early age. Also, finally, falling fertility or birth rates around Asia, but Hong Kong in particular, massive issue that we need to address, and where FemTech can help provide some of the solutions, not all of the solutions, but some solutions to support governments with their strategies in that space. So let's spend a little bit more time then talking about the investment space. So I can tell you from a global industry perspective, the FemTech industry is heavily underfunded. And some of the panelists earlier were speaking about the tech funding lull at the moment. But I can tell you that even though FemTech has a bit of a global momentum, the funding is still very problematic. So all these women at the moment are unfunded, so you're bootstrapped basically through your own funds. So what is it that you would like to share with the investors out here about your company, about the industry, to kind of make it more attractive for you to get funding? You go.
Yes. So the journey that Blissmi went through is actually quite, I think, very common. We started B2C, then we went B2B2C, and then now we're B2B2B. And the reason why that's happened is because cost per acquisition for a customer, for a consumer versus a business is obviously a lot higher, and it takes a lot longer. So a very interesting story. I won't name names, but we did do a pitch competition once to raise funds, and because we came across, like, we were very much around women's health, of course, we had one of the questions, which is, but women are not giving birth anymore. Why would you do something like that? And I'm like, well, firstly, kings need subjects to rule their kingdoms. So no government will ever allow a dying population to be a reality. And secondly, to define women's health in one point, which is around maternity and pregnancy, is also really quite disappointing. Now, I think what's really important, the lesson that we learned, is that it's not just about your great product, which we all have, obviously. It's also about making sure that the message is clear and the outcome is clear for the person that's looking to fund you. So why we are important, we're trying to create a world, like we're literally, there is no data for diverse women that exists right now. that is accessible publicly. So we have to build this data set right now. That's what we're doing. We're using data to be able to accurately predict a woman's journey. I mean, clearly, Maaike and I look very similar, but we have very different health needs. You know, we just by virtue of where we're from, how we're brought up, our race, our ethnicity, is so different. And that data is so important in being able to accurately predict the journey that I need versus the journey she needs at different stages of her life. We need funding to do that. That is not something that will just magically happen to us. We need funding to be able to find the right solutions, and that is what we are here to do today. So that, yeah.
Yeah, thank you.
Maaike, do you want to talk about the numbers just for a bit? Like, how much do female-founded businesses actually get in terms of the pie?
Well, I leave the honor to you.
Okay, I'll say
They're
it. So
shocking.
it's shocking. It's about 3%, and what you mentioned is, and that's 3% if you have a male co-founder. If you don't, then it's even less than that, right? In a market, again, what is happening? Women are your biggest opportunity. They're not only 50% of population, but they're 80% of consumption. So you have, I would say, the biggest opportunity in a market, which is health and wellness, which is booming. So I think, you know, that's to me the point that, you know, is quite shocking. Women's health should not be looked at as a niche market. It's not by any means. It's not by population or by spend. It's not a niche market. It's a market that's underserved by its product. Then we need to look at where the best case examples are and work with them. So for example, yes, it will take a long time to bridge the gap. But today, with everything that we know, for example, in women's bone health, 80% of osteoporosis that's diagnosed is in women. But you can prevent osteoporosis. You can prevent in your 20s, 30s, 40s, 50s, and so on, if you know how. And if you know that a DEXA scan is super important once you hit 50. And if you know that a DEXA scan, you do that when you're 50, and then you do it regularly. So you don't diagnose osteoporosis, you prevent it. Because 1 in 3 women will fall, and then they will have a break. And 50% of those women will die after that injury because their health will just cascade into assisted care, and then they'll pass away. So I think for OM, when I look at the opportunities that exist already in terms of the products, the knowledge, and the education for women's health, you could today completely change women's health if the government comes in the right way, and if the institutions come in the right way. And what I will say to the government of Hong Kong, look to the founders like us to create amazing products, because this is what we're here for. Don't put money into building a team to do this internally. Don't put money into taking a billboard to communicate something. Put the money in us. We're experts in this. You give us a little bit of money, we'll make so much of it, right? Versus putting a team that is part of, you know, by definition, governments move slow, and that's fine. That's what stability is for. But to shift things, look to startups like OM to help you find where the best tools are and to move really quickly. You improve osteoporosis in women. You improve menopause, you improve, postpartum healing, fertility, so many things, I would say, with low-hanging fruit. We don't need to invent something new. Let's take advantage of what's there. Let's use the amazing other founders to, make improvements in health, but come to us because we'll make so much more of your money. Yeah.
Thank you. You can see that everybody is very excited about this topic. I'm going to open the floor to questions in a few minutes. So if you're anxious to ask anything, please save it for a minute. We are speaking about investment, and obviously, as Anca said, the state for female founders is not very good. 2% of funding goes to FemTech or female-founded companies at the moment. A lot of feedback from investors is that there haven't been any notable exits, which is true, but slowly but surely we are collecting companies that are exiting, predominantly in the US and Europe at the moment, but at least there are more use cases. Also, one of the themes that keeps coming up is who actually pays for the product. So is this a corporate or is this an insurer? So apart from governments in the ecosystem, we also need a lot of help of corporates and insurers recognizing the importance of covering these products. So Grace, do you want to talk a little bit around your experience in that space?
Yeah, so I think, when there are opportunities for saving money or, especially for the government and also for employers, saving a lot of like unused hours, because a lot of women actually take a leave because they don't feel well especially around, I can tell you from perimenopause or menopause stage, actually, close to 50% said that they were not feeling well, but they didn't want to tell their managers, right? So their performance really suffer. So I think whenever there is an opportunity to save costs, I think there would be an opportunity for investors to invest in great companies who are trying to do innovative things. So I think it's a matter of working all together, and I think the aim is very clear, right? Especially in Hong Kong, fast aging society, women don't actually know a lot about their bodies, and then professionals don't have enough training in how to take care of women, and therefore there's a lot of burden on the government actually, right? So I think in this sense that there's so much work to do, but definitely there's an investment opportunity for a lot of investors to actually go past the bias that you have, because I'm well aware of the bias that people have, right? So usually women founders are considered emotional, driven by personal mission only, and kind of neglect the returns. I'm from an equity research background. I have a lot of market experience, so I don't think it applies to me and applies to other people as well. So I think we are trying to find a sustainable solution for everybody, and we can make money, we can reinvest in the society, we can reinvest in the companies.
Yeah, exactly. So this, the FemTech lens, you can look at through a massive commercial opportunity, but you could also look at it through the social impact lens, which makes it as a population health solution also very interesting for family offices maybe to explore, to invest in. I also really want to just do a shout out to Brinc and thank you for amplifying the message around women's health and giving us a platform. So I attended the conference last year and made a bit of noise to say, hey, it would be nice to see a topic around women's health or to see a little bit more female founders on stage. So thank you for listening and for taking up this message. I think at the end of the day, in order to grow this sector of tech, it requires a village. It requires all of us to kind of support it. But I would want to say is, I'm so excited about this tech because this is one of the few areas of tech which is run by women these days. So if you look at the founders, yes, there are male founders and male co-founders in this space, which is awesome, but 80% of the founders in this space are women. And there is no other area of technology at the moment where you can talk about these stats regarding diversity. It is also very important because of the rise of AI, and we could spend a whole next panel around talking around AI. But as we have a big gender data gap, as we spoke about earlier, actually supporting companies that are here on stage helps them also collect very valuable data that we need, again, to use for machine learning of AI, because at the moment with the data gap, the learning is very, very lopsided. So there is also a very good initiative and very important initiative for all women and families going forward to support digital women's health companies. Anca,
I
yes,
just want to add to this. I really want to explain what this means, this data gap. Up until 1993, no women were included in medical studies, okay? And there's, again, we could spend an hour on this on the whys. It's chapter 1 of the book. But what this means is that bias information in, bias information out. AI pulls from existing information. So it's exciting to integrate AI, but we must, when we're looking at the tech that's being built now, the bias continues with the products that are coming out because people don't understand that there's a need to deaggregate the data. So for example, you have the ear device that you put in your ear that can track everything. You need to take the male side and the female side and split it, because today this is not what medical companies do. This is not what tech does. That's not what the Apple phone, the Apple Watch does. So what this means is that women have been missed by the information until now, and because those building the new tech products don't understand that there's a need, because male and females are different down to every single cell, they're not pulling the data for women, and so we're not creating products that are adapted for women in the next 5 years that are coming out. So I think it's very important for anybody here who's launching this and gathering data to understand that women's bodies beyond boobs and tubes are different down to every cell. Somebody was talking about the vital signs for women. Our 5th vital sign is our menstrual cycle. And that dictates our temperature, it dictates the way our heart beats, it dictates absolutely everything, and that needs to be pulled and tracked. And that's exciting, but it's scary that we're not there yet.
Yeah, and the menstrual cycle is also the reason why actually women were not included in clinical trials before 1994. And just to end with a fact, which I love throwing around, this was also for animal testing. So the animal testing that was done for lipstick, for the cosmetics, for any industry was only done on male animals, not female animals, because of their menstrual cycle. Well, and on that note, I'm so sorry, we ran out of time for questions, but Grace, Anca, Tash, and myself will be around for lunch or for the afternoon. We also have a booth if you want to come and say hi and have more questions. But a big round of applause for these amazing women. Thank you.